We're less than 6 hours away from a federal government shutdown. Republicans continue to say that Democrats want to provide health care to undocumented workers, even though they know that's a lie because federal law actually prevents that from happening. Trump finally sat down with Democratic congressional leaders after he was complaining and chastising and criticizing them last week. And then what he's done is he's gone to his social media and acting like a spoiled, petulant child, posting silly, ridiculous, racist memes. Joining us right now is House Democratic Leader Hakeem Jeffries. Glad to have you on the show. First and foremost, again, I'm on social media. I'm on Twitter. And all I am seeing repeatedly are Republicans saying Democrats want to give illegal aliens health care. I see Eric Erickson, radio folks, members of Congress all saying that. That seems to be their driving talking point. What say you? You're on mute. Do we have him?
Can you hear me now?
Yeah, there we go. Go ahead.
All right. Good to be on with you. Republicans are lying, Roland, for exactly the reasons that you laid out. Federal law currently prohibits undocumented immigrants from being the beneficiaries of health care paid for by U.S. taxpayer dollars, period, full stop. And not a single Democrat on Capitol Hill is trying to change that law. What we have made clear is that we're willing, we're ready, we're able to try to find a bipartisan path forward in order to reach a spending agreement that actually meets the needs of the American people, that lifts up their quality of life, as opposed to hurting everyday Americans, which is what Republicans did in their one big ugly bill to try to reward their billionaire donors with massive unjustified tax breaks. We're not willing to go along with that scheme moving forward, just like we uniformly opposed the one big ugly bill in the House and the Senate. But we are not going to support a partisan Republican spending bill that continues to gut the health care of the American people. In an environment where there's been an all-out assault on the health care of everyday Americans throughout this year, unprecedented in nature, Republican health care crisis, largest cut to Medicaid in American history, triggering a possible $536 billion cut to Medicare as well at the end of the year if Congress doesn't act. Their refusal to extend the Affordable Care Act tax credits, which is going to result in more than 20 million people in a matter of days receiving notices that their premiums, copays, and deductibles are going to skyrocket, and they're closing hospitals, nursing homes, and community-based health clinics because of the changes that were made in the one big ugly bill, which is now law, and the attack on health care.
I saw a senator from Mississippi say that it's Democratic policies that are closing rural hospitals. And I'm sitting there going like, what are you talking about? I mean, we saw literally after the bill was passed, a hospital in Nebraska announced they were closing. And so it's amazing to hear them claim one thing when that is simply not the case. You had the entire healthcare system of Louisiana say to Speaker Mike Johnson, do not pass this bill or we are in danger.
That's exactly right. But, you know, what I've learned over the years in terms of this version of the Republican Party, as you've consistently and authentically pointed out, Roland, one, facts don't matter, right? They'll lie with impunity, and that's what they're doing right now. Hypocrisy is not a constraint to their behavior. They'll say one thing and then do the other. And of course, they've come to the conclusion in the Trump era that their shamelessness is like a superpower. But they miscalculated in this particular instance. We're less than 6 hours away from a government shutdown, and they assumed that Democrats were going to blink. But we made clear from the very beginning, we're in the midst of an unprecedented assault on the health care of everyday Americans, and we're not going to go along to get along. And the reality is, if they want Democratic votes in order to get legislation over the finish line, then of course it's reasonable to conclude that Democratic values should be reflected in that legislation. And we've made the point. Cancel the cuts, lower the costs, save health care. That's the line in the sand that we've drawn fighting on behalf of the American people, because this Republican-created healthcare crisis is an assault on urban America, an assault on working class America, an assault on rural America, an assault on small town America, an assault on Black and brown communities all throughout America, and an assault on the heartland of America. And it's got to be reversed.
So you're going to deal with the reality that, I mean, look, they are already trying to blame an impending shutdown on Democrats. Pew dropped their poll that showed this. Most Democrats disapprove of congressional leaders' job performance, while Republican approval of GOP congressional leadership spikes. And so the numbers are right here. Messaging is a huge part of this. And so what is the plan of action to actually drive this home as opposed to being bludgeoned to death by Republicans saying it's all on you, it's all on Democrats, it's your fault, the government was shut down?
Well, Republicans control the House, the Senate, and the presidency. Common sense suggests that how can it be the fault of Democrats when Republicans have complete control of government right now? That's illogical. It makes no sense. And the reality is, if Republicans were really interested in trying to resolve this issue in advance of this midnight deadline, then House Republicans would be here in Washington right now. Democrats are here in the House reporting for duty. Republicans are on vacation. Mike Johnson literally canceled votes that were previously scheduled to take place yesterday and today, and Republicans are scattered throughout the country and the world. Why? Because they have no interest in actually trying to fund the government. And most polling has shown consistently that the American people recognize who runs the government right now. Republicans have been firing thousands of federal workers throughout the year since January 20th. That's happening in the absence of a government shutdown. And there's no reason to believe that Democrats are actually going to be the party that bears the brunt of the blame. Yes, of course, the MAGA extremist base is going to follow along with anything that Donald Trump has to say. They probably believe that that AI video that he put out there yesterday was in part real. But the American people, those who have common sense, those who understand the realities of a country right now that is suffering from Republican control of government, will recognize that Democrats are on their side, fighting to protect their health care, and Republicans are the ones who've been gutting it throughout the entirety of this year and now are refusing to extend the Affordable Care Act tax credits, which is going to trigger these dramatically increased health care costs in an environment where America is already too expensive, the cost of living is too high, the Trump tariffs are making life more expensive for everyday Americans, and Republicans continue to refuse to do anything about it.
Former White House advisor staffer Dan Coe said this here: Dems are getting on shutdown messaging. We're blowing it. We need to fight. Here's what we could have done, like safe travel. Trump's mass firings could mean no TSA agents, no air traffic controls, no NTSB investigated crashes, no FBI to investigate crimes, no prisons to send anyone to because there'll be no correction officers, no weather people, no cancer researchers, no food inspectors, no Secret Service. All potential in the chopping block. This list could be 100 times longer. We need to remove the leverage Trump keeps building. We need to stop getting rolled. This is absurd, and I'm sick of us ceding easy wins to Trump. What say you?
Yeah, I don't even understand what this particular individual is talking about. We're not in the shutdown right now. Of course, we'll articulate the consequences as it relates to the shutdown that Donald Trump and Republicans will own. We certainly aren't in a position, nor should we ever, if the goal is to win the narrative, to articulate a laundry list of items to the American people, when in reality, the central defining issue of this fight is that we are protecting the health care of the American people. The American people know their health care is under assault. They care about it. They care about their quality of life. And they also care about, of course, the high cost of living in the United States of America. And the health care issue relates to these items directly, authentically, and viscerally.
Speaker Mike Johnson was on CNBC. He actually said this. I'd love to get your response.
Mr. Speaker, at that meeting yesterday, did they present, and I don't know how much you can talk about what went on, but did they give an entire the Democrats an entire wish list of things? Did they say they want health care for illegal immigrants and, I don't know, funding some TVs? They said we want all these things.
Yes, and they put it in writing because remember they filed a counter proposal continuing resolution. We filed a 24-page clean CR. They filed a dirty CR as a counter proposal included in it, and they brought this up at the meeting yesterday. They want to restore taxpayer-funded benefits, American taxpayer-funded benefits to illegal aliens. Okay, we're not doing that. We got.
He goes on CNBC says y'all put it in writing. Is there a document that you've seen? What is he talking about?
Yeah, it's a stone cold lie. The reality is we introduced a continuing resolution to keep the government open. And that continuing resolution did three important things. One, it would cancel the Medicaid cuts, which are the largest cuts to Medicaid in American history and are going to be devastating to communities all across the country. Two, we permanently extend the Affordable Care Act tax credits, which benefit working class Americans all across the country. 93% of the tax credits go to people who make $63,000 or less in the United States of America. And third, there are accountability provisions to make sure that Republicans can't engage in an agreement that's bipartisan, that then is signed into law by President Trump, and then on the back end, they engage in rescissions to undo Democratic priorities and values that we believe will make a difference to the American people. We would be fools to ever enter into an agreement with them that then allowed them to back in that agreement by engaging in rescissions without Democratic votes. So there's a provision in the law that, of course, needs to change. That's our proposal. And I have no idea what Mike Johnson is talking about. But the reality is, because they don't have a defensible position, that's probably the reason why Donald Trump had no cameras in that Oval Office meeting, unlike any other high-profile meeting that he's done this year. They don't have a defensible position. They know we have them on the run. They know we're on the right side of the American people when it comes to fighting to protect their health care, as Barack Obama himself noted just a few days ago. And we're in this fight until we win this fight on behalf of everyday Americans.
All right, Democratic Leader Hakeem Jeffries, we appreciate it. Thanks a lot. Mustafa, just your thoughts again on this impending shutdown. Everywhere on social media, everywhere, all I see is Democrats want to give health care to illegal aliens. That is the Republican talking point. Do you think Democrats have been effective in knocking that back?
No, if they had been effective, we wouldn't be having this conversation now. And, I appreciate, Hakeem coming onto the show, Representative Jeffries coming onto the show and sharing, but they've got to do a much better job. The problem is that we never put a face on the issues that folks are talking about. So you can talk about the numbers, we can talk about there's 87 million people who are uninsured and underinsured in this country, but you got to bring it home. It's got to actually resonate with folks about who those individuals are, what they're going through, what they're losing, and why we should be focused on these issues. So they're just not doing what they need to do.
Tyler, on that particular point there, Bishop William Barber always talks about this here. He says you got to use impacted people. You've got to have the voices of impacted people. And so to Mustafa's point, he's right. You got to be able to show who these people are. And it can't just be a Washington, D.C. conversation. And again, every single time Republicans say this, my response would be lie, lie, lie. In fact, this is how I roll. If I was Democratic Leader Jeffries and my staff was monitoring that CNBC interview and Mike Johnson said that, I would have said, call the control room right now. Get me on the air while he's on the air so I can tell everybody he just lied. That, to me, is the kind of response, the rapid response that Democrats have to have in the moment. Not waiting for a news conference, not waiting for a tweet, but literally say, call the control room right now, put me on the air because he just lied.
Absolutely, and I think we need some more fire behind what's happening right now, because this isn't politics. This is actual people's lives who will be affected. We need some Gavin Newsom energy, but on a whole new level of meeting them where their lives meet, and making it clear that this crisis is not a bipartisan failure, but it's a result of Republican obstruction and Trump's aligned extremism that has really affected families. And as you said before, telling the stories of those who will be impacted. So those who have to make those real life, decisions when this will impact, what families will have to face eviction notices and empty refrigerators, and knowing that families will have to lose paychecks and delayed health care and child care and housing assistance, and really making it real so that it really relates to folks and help them understand that this fight is not only in Washington, but it's connecting back into communities and how it will impact them.
Sense of urgency, Larry, that's what it has to be. We need to be hearing. And again, the numbers don't lie. The polling numbers don't lie. People do not feel as if Democratic congressional leadership are meeting the moment.
Yeah, I think one of the problems we talk about, Jeffries and Schumer, is that I think that there are politicians in terms of the communication style that doesesn't work anymore, and it's for an age that's long gone. And so they're going to have to adapt, because once again, Roland, in terms of, the Republicans, what they're proposing is not popular, but the Democrats haven't been able to articulate an agenda, a counter narrative to highlight to the American people that we're fighting on your behalf. And if they don't get it together, Roland, we got midterms coming up in a short period of time. And then a few years after that, we have the election. But once again, they don't really have to refine the communication style. And I agree with you. It is essentially, you're going to adopt the communication style as more like urban guerrilla warfare, is that you're being the aggressor when necessary to put out, to communicate to the American people what's at stake here. If you don't wake up, that, you'll lose your health care, and if far more, lose your health care, it'll increase mortality rates. Once again, not being able to put food on the table. But once again, this communication style has to be more aggressive. And I agree with you. You got to be, and look, if you have to be in the studio with them as they tell some of these lies, but you've got to have people also who are out there, Roland, who are really good at communicating. And let's be clear, sometimes the Democratic Party has tried to mute those individuals, Jasmine Crockett among others, who are excellent communicators.
All right.
Hello, I'm Isaac Hayes III, founder and CEO of Fanbase, and I'm here with a very important message. We are at a turning point in the Black community where we must have equity in the apps we use that scale to billions of dollars. But this time, we own the infrastructure, we own the culture, and we shape the future. And Fanbase is the future. Fanbase combines the free functionality of Instagram, TikTok, and YouTube into an all-in-one platform built for the evolution of social media and monetization. With over 1.4 million users, that's real proof that we are shifting the conversation of tech ownership and equity for creators. So right now, I want you to go to startengine.com/fanbase and invest today. The minimum to invest is $399. That gets you 60 shares of stock in Fanbase at $665 a share. This marks a turning point in Black ownership of social media. If we don't take this opportunity to own social media right now, we will always be customers to our own creations. And that can't go on. So once again, go to startengine.com/fanbase and invest today. We must own the platforms where our voices live, our stories matter, and where our culture drives the world. Thank you.